Sarah, I'm so glad you made it back in today. Our plan for today is to go over the exam, and after collecting the information from the exam and what you have told me that you've been experiencing, I believe you have something that we call patellofemoral pain syndrome or chondromalacia patellae. In English, it just means that there is some inflammation and pain due to the way that your kneecap is riding on your femur bone. I believe that this is due to the fact that you have increased your running in such a quick time. So before 2 months ago, you were running about 5 to 7 miles at most. And then now you've been running, in the past 2 months, you've been running 15 plus miles a week training for your half marathon, which is understandable because you're in training that you need to get those miles in. But unfortunately, your knees were not prepared for that load. So what I think we can do for this, I do believe that we can help alleviate some of this discomfort and get you back to your running. And I think that if you can come in about 3 times a week for the next 4 weeks, we can have this almost completely resolved. So with that being said, some of the treatments that I want to do is, first and foremost, I want to do some physical therapy. So by strengthening the muscles surrounding the left knee joint, we can help to support that joint and support the way that kneecap is moving with that joint, and that will help take some of the load off the knee itself. I also would love to do some soft tissue therapy. This is going to relieve any tension in those muscles surrounding the knee joint, and that will help to prevent any pulling and added stress to that joint. And I would also, of course, like to do adjustments. So we can adjust the hip, the knee, and the ankle and foot, and then this will all help for you to move better throughout those entire joints and improve your running. Some things associated with this: after the adjustment, you may feel sore, especially if this is your first time being adjusted. That is normal, some mild soreness. If you feel anything more than just soreness, please let me know. And then the same with the soft tissue therapy. It can cause some reddening of the skin and some soreness. And the same with the physical therapy. Again, it can cause some soreness. So please let me know if you're experiencing anything more than that. But some mild soreness is normal and can be expected. So here at our office, the cost we're going to do is a bundle. So for the adjustment, the soft tissue therapy, and the physical therapy exercises, it's going to cost you $70 a visit. And like I said, I'd like to see you 3 times a week for the next 4 weeks so that we can resolve this condition. I know that you've had some concerns. Some of your concerns is, one, you want to be able to run your marathon or your half marathon in 3 months. And I think that is definitely something that is achievable as long as we stick to the treatment plan and stick to the therapies that we have designated for your care. And then also, I know you're concerned because your aunt had a knee replacement and you've been told that you have bad knees in your family. But I can assure you that what you're experiencing, the patellofemoral pain syndrome, is something that many runners experience. And it's not due to degeneration of the joint. It's just due to overuse of the joint. So if we back off of the running just a little bit, as in, you have pain when you run 1.5 miles, well, let's run 1 mile and work our way up so that we're not irritating the area. I do not believe that this is degeneration. You are very young, you're healthy, and you do not have bad knees. So this will recover. I know it seems scary right now, but through treatment and following this care plan, we can get you back to a place and we can get you running that marathon in 3 months.